Hello, good morning. Colonel Mike Foutch. I'm the new hospital commander here at the 88th Medical Group. Thank you for the paid applause from my staff who cheered for me. That was very nice of them. I want to talk to you about three quick topics right off the bat, and then we're going to have our team talk to you about some more, and then we'll open it up for questions and answers. I want to talk to you a little bit about trusted care. And hopefully you've heard about trusted care. You may have seen posters about it, but maybe you're kind of like, what is going on with this trusted care theme? And so the entire healthcare industry is on a journey to improve patient safety. If you're paying attention to what's going on in the civilian community and healthcare in general, we are trying to improve our patient safety and to be increase a patient safety culture. And so in the Air Force, in the AFMS, at our treatment facility, and across all military treatment facilities in the Air Force, our journey is called trusted care. And what does trusted care mean? Well, it means paying attention to the patient. It means listening to each other. It means respect for people, respect for each other in the work center, respect for our patients. And we have an entire program that we are implementing in every MTF really, but we're doing great things here with this. And you'll see on the left side of the screen all the different things that are going on, from toolkits for our staff in order to improve their communication and improve their patient safety, to patient safety champions across the MTF, to our patient safety reporting system. When we do make a mistake, when we do make an error, how do we report that? How do we talk about that? You can imagine that sometimes when you make an error in healthcare, it's very personal, it's very emotional, it can be it's a very important issue. How do people talk about those mistakes? We have to learn how to talk about those better, and we're working very hard on improving that communication. Two things that you can help us with that. We talk about a duty to speak up. So every airman, every patient has a duty to speak up and talk about something that they don't see that's going correctly. And so we empower our youngest airmen in our clinics. If you see something wrong or something's not going right, you have a duty to speak up and tell somebody about that. The other thing is our patient engagement. Cindy chairs several different groups that have patient interaction with them so that we, the executive team, our staff, can get feedback from you about how we can do things better. I think she has, I want to say, 6 ongoing groups working through different issues, and you can talk to us if you'd like to be a volunteer for those. One of the things that we are working hard on is how to communicate internally amongst our staff, and so we talk about asking a clarifying question. So you can imagine sometimes a lower-ranking airman might have difficulty asking a senior officer if they don't think a procedure or process or something's going right. How do you tell that major that they're wrong, right? And so we tell them to ask a clarifying question. So, excuse me, can I ask a clarifying question? I want you to help me. You will blow your provider's mind if next time you're sitting in their office, you say, excuse me, can I ask a clarifying question? The look on their face will be fantastic, right? But you will have a connection with them, and I guarantee that you'll be able to get your questions answered. So I wanted to talk a little bit about where we're going with a culture of patient safety and trying to get to a goal of zero harm for our patient care. It's a top priority amongst our MTF. The other thing is I wanted to talk to you a little bit about inclement weather procedures. So inclement weather procedures are right around the corner. And so in the past, this MTF has shifted between open and closed, and we've had some struggles with that in the past. And so I wanted to let our beneficiaries know that we are going to follow our wing commander's direction when it comes to inclement weather at our facility. Okay, so if the wing commander comes out and says that because of hazardous roads and because of hazardous conditions, we're going to be on a 2-hour delay to the base, the med group will be on a 2-hour delay as well. So if you had a 7:45 appointment and we're on a 2-hour delay, I want our staff to come in as it's safe for them to get in under that 2-hour delay. It doesn't mean we won't see you that day. I'm going to ask my staff to do everything they can to still see you during the day, but it probably won't be at 7:45, right? So hopefully our staff will get in and get everything taken care of under that 2-hour delay, and then we'll start to take care of those patients who had their appointments during that time, and then I'm going to ask my staff to see what they can do to take care of you if your appointment was during that delayed time. if the base commander closes the base because of hazardous conditions, we're going to close our outpatient services, right? We will not ever close our emergency services. Our ER, our inpatient unit, those services, they will not close. They will not be on 2-hour delay. Those are mission essential type services. This will be coming out in a bulletin that I'll put out through the med group and get out to our beneficiaries to talk through those inclement weather delays. But I don't think it's a good idea if our wing commander has said that there's hazardous conditions that we have 2,000 staff members that work in this facility, and we generally see 1,500 people a day. I don't think it's a good idea to then put all those people on the road to make sure they make their appointment during the time that our snow teams are clearing roads and it's potentially hazardous icy road conditions. The last part is you may or may not have heard about our transition to the DHA. So the DHA is the Defense Health Agency. And Congress has said by law that starting in, I think, 5 days, the DHA will be responsible for the oversight of all MTFs in the Department of Defense. That means that policies and procedures regarding healthcare will now be oversighted by the Defense Health Agency. And really what that means for you is nothing. It really means nothing whatsoever. Our patient care will not change. There are policies with regard to what form you use when an active duty member has an injury and you have to give them a profile, right? That form is different in the Army and the Navy and the Air Force and the Marines, and it causes a lot of confusion across the services. The DHA, the Defense Health Agency, is going to try to align those types of services and policies so we're all using the same form, so we're all using the same process, and try to create a healthcare system that has a lot of similarities across the different services. It means they may put out policies about how long your appointment times should be, whether they're 20 minutes or 30 minutes or 40 minutes. But it's not going to change how your provider delivers healthcare. It might change who I report to. As the medical group commander, instead of reporting to the wing commander, I might now report to the Defense Health Agency leadership, and they might write my report card, if you will. Hopefully that's not something you'll ever worry about or even know about. I believe this transition will be seamless to you, the patient, and to the majority of our staff. But there are some alignments with who reports to who, which is going to change what happens. Last piece on the Defense Health Agency transition. Although this transition happens 1 October, they could not grab 275 MTFs all at one time for their oversight, so they are doing a phased transition. So the 88th Medical Group here at Wright-Patterson doesn't actually transition under full alignment of the DHA until 1 October of 19. Starting next month in October, we are required to follow DHA policies if they supersede Air Force policies, but I don't end up reporting to the DHA until next October of 19. And really, those are the biggest differences today and next month with our DHA transition. There is a lot of communication in Washington, D.C. about what will happen with this, and it changes fairly rapidly, almost on a daily basis. So I don't want to get too deep into the DHA transition or what may or may not happen, because what I brief you today could change tomorrow. But the biggest point on that is this MTF will transition 1 October of 19, and between now and then we'll see a lot of different things come out that will help us understand what's going to happen in that transition. I'm really glad you're here today. We've lined up a fantastic cast of speakers, and I'm going to turn the rest of some briefings over to them, and then we'll open it up to questions.
Well, good morning. Thank you all for coming. My name is Doug Bonner. I do work with Humana Military, and we are the East Region contractor for TRICARE. I'm just going to go over some quick information for you. With the last town hall, we provided a lot of information regarding the changes that took place this year. So there's just going to be a couple of points here today that we're going to kind of hone in on and give you more information. So this slide kind of gives you a picture of our two main plans, TRICARE Prime and TRICARE Select, and you can see the side-by-side comparisons. So as most of you know, on January 1st of 2018, TRICARE Select replaced the TRICARE Standard and TRICARE Extra health plans, and TRICARE Select is pretty much the same. It still acts as a preferred provider organization or option or a PPO. style plan, and it does give you more freedom of choice for your providers. Whereas TRICARE Prime, as I'm sure most of you know, is a managed care option that's available within Prime service areas, geographical locations, and they do offer the affordable and comprehensive health care, much like an HMO, but it also offers fewer out-of-pocket costs. So all beneficiaries other than active duty service members and TRICARE for Life beneficiaries must enroll in either TRICARE Prime or TRICARE Select to be covered for civilian care. So, and we're going to get more into that. Beginning January 1st of 2019, beneficiaries that choose to switch between TRICARE Prime and TRICARE Select must make these enrollment changes within 90 days following a qualifying life event or during an open enrollment period. It's not going to be whenever, like right now, you can choose whenever you want to change. Beginning in the new calendar year, then you can only make those changes during a qualifying life event or the open enrollment, and we're going to talk more about what that entails. So if one member in a sponsor's family experiences a qualifying life event, then all eligible family members may change their enrollment status during that qualifying life event period. And during that 90-day period, no matter when you initiate this change, within the 90 days, coverage will be retroactive back to when the qualifying life event occurs. And I'll talk a little bit more about that when we get to the next slide. But if you're not enrolled in a TRICARE plan, then you're going to only be able to receive care at military hospitals and clinics on a space available basis, and civilian care will not be covered. So what is a qualifying life event? Well, whenever you have like a major life change for you and your family, then these are what are known as qualifying life events. Now, being that we are a military facility, then there's some different things that occur with military members that may not occur with the normal civilian population. So we've given you this table here that shows you what the different qualifying life events are. So under the military, of course, the activating and deactivating, which mainly applies to your Guard Reserve members whenever they come on or off active duty. For members who deploy, anyone who might be injured on active duty, anytime that you PCS or move, and anytime that you separate from active duty or retire. Those are those specific military events that would create this qualifying life event. For the family themselves, things that occur is what you would typically think of, like getting married, getting divorced, having a baby or adopting. If you have a child that goes off to college, or would they age out of the TRICARE program, if someone in the family becomes Medicare eligible, and anytime that you move from one zip code to another, and if there's unfortunately a death in the family, or if you gain health insurance through an employer or you lose other health insurance. And those are also considered qualifying life events. And then you would have that 90-day period from the beginning of that event to make those changes. So for example, you have a child. Obviously, as soon as that child's born, you're going to be dealing with that and getting situated, so you're not going to be able to make those changes and get the child into DEERS immediately, so you've got 90 days. So if you wait to day 89 to get the child enrolled in DEERS and enroll in a program, then that coverage would go back to the date of birth. And the same as if you're retiring from military, you've got 90 days from the date of retirement. If you wait till day 89, then the coverage would go back to day 1 of your retirement. If you wait past that 90 days, then that period that you had not enrolled will not be covered, and it would start on the day of that actual that you enrolled. So now we get into what are open enrollment, or the open season. So this is the annual period. I'm missing a slide here. This is the annual period for which active duty family members, retirees, and other non-active duty beneficiaries can enroll, change, or cancel their enrollment in TRICARE Prime or Select for the following calendar year. So open season does not affect your TRICARE Young Adult, TRICARE Reserve Select, TRICARE Retired Reserve, or TRICARE for Life. It is only for TRICARE Prime and TRICARE Select. So open season will occur each fall beginning on the Monday of the second full week in November through the second full week of December. So for calendar year 2019, open enrollment dates are from November 12th to December 10th, 2018. So that'll be the period coming up in November and December that you can make changes that you want to take effect beginning in January. If you're happy with the plan you're in and you don't need to make any changes and there's no action required, you'll stay in the current plan that you're in.
Hello, I'm Ken Kirkland from the Beneficiary Support Office, Beneficiary Counselor for the Medical Center. Today we're going to talk about FEDVIP. FEDVIP, here's another acronym for your dictionary of acronyms. FEDVIP stands for Federal Employees Dental and Vision Insurance Program, okay? What's gonna happen, next slide, is the TRICARE Retired Dental Program, as you know it today, will go away the 31st of December, okay? That plan will go away on the 31st of December. So to get into a dental plan, you would need to enroll during open season into the Federal Employees Dental side of the dental coverage you may have. And that's gonna be open season, November the 12th through December the 10th of 2018, this year, here in a few months, to get you enrolled to carry on to 1 January of 2019. Those of us who are already enrolled in the TRICARE Retired Dental Program at this time, you must enroll into with FEDVIP to stay current for your dental program starting 1 January, because you will not automatically be enrolled. You have to enroll to stay in the program starting 1 January. The second part of FEDVIP we're looking at is vision. The vision coverage that's out there. The vision coverage, there's 4 plans in the vision, okay? And you can decide which ones you want. When you're going in there, it'd be open the season the same. Qualifying beneficiaries will be anybody that has a TRICARE health plan except for our active duty members. So it'd be for the families, retirees, etc. with that health plan. Under the dental portion that we're looking at would be that there's 10 plans out there that you could enroll into and go into those plans to decide which plan you may want. And how do we get to those plans? I'll tell you in a minute. We will end up having town halls during the open season for this FEDVIP. We're also going to cover the qualifying life events. We will also cover open seasons. It will be during the open season time frame. We'll have that, so we'll have them in November, part December, but we're actually going to start October the 9th. On a Tuesday, there'll be 2 per Tuesday. If you'll look at the Skywriter, the monitor in the atrium, and the website, the Facebook for Wright-Patterson Medical Center, you will see those coming up. And then that way you can get a more in-depth briefing of this FEDVIP open seasons and qualifying life events. Also, there's more information for you if you go to the tricare.benfeds.com. You can go to this website. It will tell you about the vision, the 4 plans. It'll tell you about the 10 dental plans out there. It'll tell you about the open seasons coming up. You're able to compare the plans that you may want. And yes, Delta Dental is one of those plans. So this will give you a lot more information and get you ready for open season and have that dental coverage or vision starting on 1 January. Thank you very much.
Good morning. I am excited to share some good news with you, and that is a long time coming, but we do have the new Kitty Hawk Pharmacy. We have an opening date for you, and it's going to be on Tuesday, November 13th. The new Kitty Hawk, it's located just across the street from the gas station in Area A. The new Kitty Hawk will provide the same service that the old Kitty Hawk by the commissary does today, and that will be for all your refill pickup as well as off-base prescriptions. We do have some handouts and some maps in the back. Please do grab those on your way out to share with your friends, certainly. One of the things that we wanted to make mention is not only is this a new building for you, but it's also new equipment, new processes, and we have a lot more space. So it will be new for us. So we do ask for your patience and bearing with us as we adjust to give you the best service and also safe care in the pharmacy. I did want to call your attention to some of those times when the wait times are the highest, if possible, so you can avoid plan your trip to the pharmacy if you can away from these peak times. And those are at the Atrium Pharmacy between 10 and 2 o'clock, and also the Kitty Hawk later in the week, and also good weather days. So, all right, thank you very much.
Good morning, everyone. I am very happy to be here to give you an update on when we are getting the influenza vaccine. So I see lots of pens and paper, so I'm very happy to see that as well. Currently, we do not have the vaccine, but we do expect to get it in sometime in October. So I want you to take a look right up here at that flu hotline number. That's probably one of the most important things that's on this slide. That phone number, 937-904-3588. That will have the most current information about where and when the flu vaccine will be available to you. So please check it. We also just added a message to the secure messaging, and at the very top, when you log into secure messaging, there'll be an update there as well. Okay, so I personally went out to several of the facilities here in the local area and wanted to tell you that these places right up here, Walgreens, Walmart, Kroger, and Rite Aid, do currently have the vaccine. So you can go there. That's within our network, and there is no copay. All you have to do is go in and show your ID. And then once we get the vaccine, there will be a beneficiary line, and we expect to be doing this on the 29th of October, Monday, Tuesday, Wednesday, and Friday. That Thursday is our training day, so we will not be doing it on that Thursday.
All right, like Cindy said, I'm the office manager of the Family Health Clinic. I saw you raise your hands. Those of you are family health patients, so that makes me a little excited, makes me feel that what I'm going to tell you is worthwhile today, okay? I'm only going to take a couple minutes, but hopefully you'll find this informative, and afterwards I'll be in the back. If you have any other questions, I'd be more than happy to answer them. We're going to talk about enhanced access. Now, we've been doing this enhanced access for about a year. We haven't really publicized it too much because we're trying to perfect the process ourselves, but we're getting there. So I want to talk to you about it. What is enhanced access? Enhanced access is increased access, maybe mainly more timely, increased availability. Does that make you happy? Hopefully it does, okay? We're trying really hard, okay? The key components of that and the things that you can do to help us is by using TRICARE Online Patient Portal. How many of you are using the TRICARE Online system, the patient portal? Okay, that's great. If you're not, pick up a brochure in the back before you leave and make sure that you get that information. You can find a lot of help in that system. Also, we have the patient portal secure messaging. It was formerly called MyCare, then we changed it to Relay Health, and now we're just going to call it patient portal secure messaging. How many of you use that? All right, great. That is the best way to communicate with your healthcare team. We're also going to talk about web visits really quick. That's an exciting additional service that we started providing. And telephone appointments, okay? All right, here's just a quick picture of what it looks like when you log into the TRICARE Online Patient Portal, okay? Appointments. You can book appointments through the TRICARE Online Patient Portal. In the past, you may not have been very successful at finding patient appointments, but go to the next slide. This is what it looks like when you ask for an appointment. 100% of my face-to-face appointments in family health are available to you online. So if you don't see something with your provider, it's probably because they're out for a period of time or something like something that is taking them out of deployment or something along those lines. But you will see appointments available with your entire team, the team that your provider's on. We do highly encourage you to select an appointment with your assigned PCM if at all possible, okay? This does not prevent you from booking with any team member, but we prefer that you book it with your assigned PCM. And if you book with another team member, sometimes don't be surprised if we give you a call and try to realign you with your PCM. It's for your own good. And the telephone appointment that I'm going to talk about here in just a minute, those are soon going to be available for you to book online too. And those are phone appointments directly with your provider. And when you look at those appointments, you'll see a little telephone next to it once we activate that feature. Next slide. Also on the TRICARE Online Patient Portal, you'll see the health record button. It was formerly called the blue button. It's still blue, but now we call it the health record. In there, you'll see a lot of, almost all of your radiology reports and your lab results. And every time you come in for a visit, there's a little summary that'll pop up on there, and it'll track your vital signs for you and all kinds of things. The vital signs, if you're like me, it's a little discouraging because after I retired, I saw my weight bar go way, way up. So there's an uphill climb. I'm working on getting it back down. But there's a lot of good information on there, okay? And then there's a link to that secure messaging. Many of you are used to typing in relayhealth.com. It's changing to TRICARE online or TOLsecuremessaging.com. But the easiest way to get to it is just to go right here and click on that button. It'll automatically take you to that website. In the near future, we hope to have a single sign-on, meaning when you log into TRICARE Online and click on Secure Messaging, it will automatically log you into Secure Messaging. But for right now, you still have to have a separate password for the Secure Messaging. But hopefully we're improving there. Okay, once you get into Secure Messaging, there's a lot of different features there, but I'm going to talk to you about just a couple. I want to highlight the next to the red circle there, there's one called Health Records. Okay, that is not something that we populate. We do not put your health records in the Secure Messaging site, but that is completely editable for your use. So the Health Records is a great place for you to keep track of your personal health care, and you can put just about anything in there that you want to keep track of, and it will stay in that system for you. Again, it's not something that your healthcare team puts in there for you, but that's a feature for you. The other thing I want to talk about is right above the red circle. You probably can't see it, but there's a little link called Education. There is a whole library out there of education materials that you have access to. Almost every disease process that you can think of, and some that you can make up, they're on there. And so that's a great feature, and you can pull that out and look at those anytime. Now I'm going to talk about the messages. You click on the messages, and this is where you will check messages you've received and how you send messages. You can request appointments on there. Most of you, if you've used it, you kind of know how to send that message. But you click on the compose button right up there, that blue button, and you can free text any message you want, goes straight to your healthcare team, okay? But what I want to focus on is the web visits. We talked about enhanced access. Web visits is a great part of that enhanced access. You don't need an appointment to have a web visit. You can just go out there, click on that web visit. Now this is for those of you who are enrolled in Family Health, okay, that this feature is available to. You click on that web visit, and what you see there to the right is a whole list, and then there's even more of different symptoms and conditions. You can use that for follow-ups or a new issue you're having or something like that. Rather than pick up the phone and call us to get an appointment, this may work for you. You just select from the list, and it will take you to a series of questions. Those questions are the same exact questions that your provider would ask you if you came in person. It's just asking you online. You answer the questions. It will take you through a series of questions based on your answers. And then when you get to the bottom, it'll allow you to free text some other information in, and you can send that to us. What a web visit is, different than another message, is that web visit comes into your healthcare team, and then it gets added the same day to your provider's schedule. It goes on their schedule as an actual visit. Now, you're not going to hear from the provider by phone, and you're not going to come in. They're going to respond to you through this system. Okay, so usually within a day, that's our goal. Sometimes it does take a little bit longer, but usually within a day, you will get an answer, and a lot of times that will settle the issue for you. We may use that for follow-ups or just about anything. You saw the list on there, and it is very extensive. So we encourage you to use that if you can. You also may be, if you book a face-to-face appointment with us, and we may be able to take care of it online, and you have an active account, you may hear from us, and we say, hey, rather than come in for your appointment, would you fill this out? And then we can see if we can take care of you and save you a lot of time that way. Now, the other thing is phone appointments. I talked briefly about that a minute ago. Phone appointments is an appointment that you are going to set up directly with a provider in the team. Most of the time, your assigned provider. That's our goal. But you can set up those appointments. Again, I told you soon those will be available for you to book online, but right now they're available for you to book through the appointment line. If you want a phone appointment, all you have to do is call the appointment line and say, I would like to schedule a phone appointment. Again, that is an appointment that is set up a personal call from your provider. You may get a call ahead of time from one of their staff to gather some more information and put that in the record for the provider when they call you, but that is a phone call from the provider. I can't stress that enough, okay? So that is, and again, we may use that as an alternative to an appointment you have scheduled in the future if we feel that it's appropriate. You always have the option of a face-to-face visit. These are not things that we're going to force on you. So if you get that call and say, hey, you know, Dr. So-and-so may be able to take care of that over the phone for you or through a web visit, are you interested? You have that option, okay? If you'd rather say, nope, I want to come in and see him face-to-face, that is absolutely your right, and we will honor that request. Okay, just to summarize, I know there's a lot of information, and I'm excited about this. I'm excited to talk about it, in case you can't tell. And I'll be in the back to answer your questions about any of this or any family health-related thing. But basically, I've hit on a few key points here. We're making every effort to provide you the continuity in your health care that you want and you deserve. And that's by assigning you with your provider every time, every encounter. Sometimes that's not possible. You understand deployments and other things. When your provider's out on vacation, they are allowed to do that once in a while. We may have to have another provider take care of you, but we do strive for the continuity. Again, it's timely. That web visit, you can do that anytime you want. And then the next duty day, I mean, if you wake up at 3 o'clock in the morning and, you know, oh, I need to follow up on my diabetes, you can go in there, fill out the questionnaire, and then the next day, we'll get that and we'll take action on it. Okay, so it's timely care. And again, I talked about the different options. One thing I didn't point out earlier that I'll point out on here is in our, I'm talking too long. In our clinic, we have a clinical pharmacist and a clinical psychologist, and sometimes your needs can be met by them, so we can also offer that.
How many of you sometimes don't even know what services are provided here in the hospital? And because that's a very common theme. And so Colonel Foutch asked if I could just give a brief gestalt of what services are offered. So if you have a choice, you can potentially request to come to our facility because we'd love to take care of you. We are a multi-specialty service. Orthopedics is hands down our largest service, and they offer a plethora of surgical specialties. They have hand surgeons, orthopedic surgeons, joint specialists, spine surgeons. Probably the biggest one that we'd love for you to be aware of is we do a lot of joint replacement here. And specifically, from a marketing standpoint, you'll hear people talk about the anterior approach to hip surgery. And the surgeons here, they're cutting edge. They do that. It's faster recovery, less morbidity in terms of pain, and then quicker recovery. So, you know, just tell folks that this is a full service capability. They can do it all. We have a spine surgeon, orthopedic fellowship trained, who does a lot of decompression and is fantastic. I think he's one of the best surgeons in town. And then finally, included in their service is podiatry, and he focuses a lot on the surgical management of foot disorders. So not only does he do the general care, but surgical abnormalities that most people don't realize. He has additional training in that as well. Included also within orthopedics is the neurosurgeons. We have 2 neurosurgeons here, and like the orthopedic spine surgeons, they do a bunch of back surgeries, and also in the cervical spine or in the neck. In addition to them, we have a very robust urology practice who've engaged with our VA counterparts. And specifically, they do a lot of robotic surgery. And for those of you that aren't familiar with that, it's, again, a very minimally invasive, even less invasive than what used to be the laparoscopic techniques. So faster recovery, less pain, getting up and moving a lot faster. And they're one of the biggest users of this service. But if you think about it, they do it all from the kidney, ureter, bladder. They manage the entire system. So if you have a problem, ask your primary care doc. They will get you in, and they don't turn anyone away. Like our urology counterparts, the ENT doctors, they don't just do ear, nose, and throat. They do everything basically from the neck up to the top. So from hearing, they assist folks with that. They of course handle some of the head and neck cancers, most commonly thyroid and parathyroid. But they also wanted to mention sinus disorders, and that's especially in the miasma valley, folks really suffer from this, and they can help tremendously. Ophthalmology. They also do, you hear about the Refractory War Center, that's only active duty, but they do a significant volume of cataract and glaucoma type surgery. And we wanted to push that out because a lot of folks just don't know that. And again, with two surgeons, they are welcoming everyone. So plastic surgeon, I took a whole slide. I'm a plastic surgeon, so I think I deserved more space. But very passionate about the breast reconstruction. Every woman who has breast cancer surgery, regardless of what you choose, you owe it to yourself to go talk to them. Get the information. You can learn a lot. It's now becoming a law in many states that you offer this services. Years ago, in fact, an article came out, less than 7% were actually referred for counseling. So they do a lot of the breast reconstruction surgeries here. Eyelid surgery, I threw that up there. ENT, ophthalmology, and plastic surgery all offer that. And it's not a cosmetic procedure for those that have visual field disturbances. And that's the biggest thing. In fact, that's probably the greatest volume in this hospital, where folks are just having problems because their eyes are getting droopy and they're having headaches from having to practically lift their brows up. I mean, that's a functional disorder. That's covered benefit, and we can get you in quickly, as quickly as anyone off base, and we would love to see you. We put a little blip in cosmetics. Recent changes at DHA level now makes it easier, but this is entirely elective. It's entirely up to you. You can go to wherever you want. So as a result of that, you can just go up to the general surgery, plastic surgery clinic and fill out a form and say, hey, I'd love to go talk with them just to get some information, and we'll get you in. You're not obligating yourself to anything, you're just getting information. And we pretty much, this is one of the specialties that operates from the top of your head all the way down to your feet. So we can talk and educate you on many of your options. Skin cancer, I threw that up there because if you can't get into dermatology, if they're full, we can take care of that. We can handle probably 95% of them. So just feel free. And again, if it's something that we feel the dermatologist needs to handle, we will gratefully or gladly call them up and get you in to help them. We'll assist you with that referral process. And also the varicose vein problems, we offer that service. In the old days, they used to make a big incision in your groin and pretty much avulse everything from the bottom of your feet up. And in doing so, they would take out all your lymphatics, high incidence of nerve injury, and now we've kind of gravitated to the minimally invasive SLIC type of surgery, where we use lasers, where we go in and we cauterize the vessel and make it less morbid and symptomatic for you. But we are, and I'm happy to say, we are the only facility in this city, including any of the facilities downtown, that offers a VenaSeal, which is like a super glue. So you go in the same way, just your little tiny 2mm incision, and instead of doing the laser treatment, you inject a super glue. And there's a small population that fits, but it's a very you walk in, you walk out type surgery. Women's health. Again, this is a very broad picture, but I want you to know about, in terms of the gynecologic options and specialists we have here. We have a gynecology oncologist who works down at Miami Valley as well, works with them. He knows all the techniques down at the Valley, but he also offers the services here. All of the surgeons are skilled in robotic surgery, which you'll be hearing a little bit more about later on and describing that. But along those same lines, we have a laparoscopic fellow who's the minimally invasive surgical specialist. And again, you're in the hospital less, there's less pain, you don't have as large incision. And the flight commander who I see standing in the back of the room, to make sure I plug this for him, almost 100% of the non-cancer operations are performed through one of the two minimally invasive techniques, whether it's the robotic or the laparoscopic techniques. And that means a lot for folks trying to get up and about and get on with their lives. We have a urogynecologist, basically is a women's health surgeon who specializes in urology. And so if you need help with potentially seeking that type of a specialist, we have them here. And he's one of the few in the Air Force. And then finally, just to conclude, general surgery, again, they offer full services. They will get you in. There's a minimal wait time. In fact, doors are open for business 24/7 practically. But they don't offer just breast and colon cancer type treatments, and they'll usually work jointly with plastic surgery in the breast cases. But acid reflux, you see there's a lot of techniques that are being pushed out there for that. And I think the benefit of coming in and speaking with our surgeons is they'll tell you their honest opinion of what would be best for you. And sometimes if you're a hammer, everything's a nail. And so they're hammers and nails, and they do it all. So I think it's good to hear consultations from more than one person. And that's what I think we can offer you. And then finally, the robotics. Dr. Glush is giving a talk next. He's the #1 surgeon in the DOD when it comes to volume of robotic surgery. So he knows, and he's going to talk to you a little bit more about that. But again, just like before, smaller incisions, less postoperative pain, quicker recovery, and morbidity. So I think there's a lot that our services have to offer. Almost every service requires a referral from someone, and your primary care docs are the best access to get in, and they all have the ability to do it. And if you're seeing a subspecialist, they also can put in the referral. And as I mentioned, the cosmetic component of plastic surgery, just come on up, fill out the form, we'll get you in a couple of weeks. Happy to see you.
Dr. Tlarzik referred to the benefits of the robot. It's something new here at Wright-Pat. We've had it just for a little over a year now. Robotic surgery started more for urology with the prostates, but we've adopted it, we've stole it for general surgery, and we're the fastest growing field for robotic surgery. And the reason I want to come talk to you is our big field is hernia surgery. That's where we're seeing huge difference. There's been a few studies out there, but patients who get robotic hernia surgery are using less pain meds than laparoscopic or open. They're staying in the hospital a shorter amount of times. They're going home quicker. They're back to their jobs quicker, back to their families quicker, back to their normal way of life. And so we're really using this. We've got, I do a bunch of robotic surgery. There's another one of my colleagues that's doing it. We're getting the other 2 people spun up on it. Here in another month or 2, everyone in our clinic's been doing robot surgery. So it's available for everyone. Like Dr. Tlarzik referred to, we have open availability today even. I mean, we don't see people the same day, but pretty much we have open availability whenever. If you feel like you might have a hernia, someone told you have a hernia, you have a bulge somewhere in your groin, or you feel like by your belly button you have a little hole there or something, let your primary care doctor know. They can put the referral in. We can get you in right away and at least get it looked out and then talk to you about the different options and get it fixed. Because I know there's a lot of people out there with hernias who haven't done anything about it, but we can get you taken care of and get you home back quick.